A Yale Dean walked into the US Senate to talk about saving lives. What happened next stunned everyone in the room. On Capitol Hill this week, Senator John Kennedy of Louisiana sat across from Dr. Megan Ranney, an ER doctor, a Yale Dean, and someone who has personally treated gunshot victims for 20 years. What was supposed to be a routine public health hearing turned into one of the most uncomfortable, revealing exchanges of the year. Kennedy came armed with one-liners. The Dean came armed with data. And by the end, nobody in that room left unscathed. Let me show you exactly what happened, and then I'll break down what the cameras didn't catch.
So Mississippi, Louisiana, and Missouri actually have higher firearm death rates. Obviously, there's certain...
What about Chicago?
So I don't live in Chicago. It's not my primary area of research.
You don't have an opinion on that?
I think there's easy access to firearms combined with environmental conditions, lack of great education. There have actually been studies showing that when you green vacant lots and repair abandoned buildings in urban neighborhoods, you see decreases in gunshots, in violence, as well as in stress and depression in the neighborhoods around them.
No disrespect, Doc, but that sounds a lot like word salad to me.
I am a board-certified emergency physician and dean of the Yale School of Public Health. I've spent nearly 20 years working as an emergency physician in a top-tier trauma center. Here in the U.S., treating firearm injuries is a routine part of emergency medicine. During our training, we learn how to identify who must go right to an operating room, how to crack the chest of someone who's bleeding out, and how to notify family members of a death. While in training, though, we rarely, if ever, learn to ask what could be done to prevent a gunshot wound in the first place. That changed for me about 15 years ago, after I cared for a young man, the son of a first responder, who had shot himself with his parents' firearm. He was the first patient I'd cared for who had intentionally shot himself. I couldn't save him, but he changed my perspective on gun violence. First, his death drove me to learn more about firearm suicide, to realize that in the emergency department, we rarely saw suicide attempts from a gun, not because they were rare, but because they were so often fatal. Second, his death led me to question why we didn't think about gunshot wounds the same way we think about drunk driving or heart disease, as something we can and should prevent. Most disturbingly, I noticed the difference in how my colleagues responded to this suicide compared to the everyday toll of community gun violence. Since that case, I have treated people for every type of firearm injury, from domestic violence to victims of drive-bys. I've saved some lives, but not all, and have informed countless families of the loss of their loved ones. And it is because I have had a front row seat to our nation's growing firearm injury epidemic that I have worked to define and implement a public health approach to this crisis. To clarify, this is how a public health approach works. First, we gather data on the problem. How common is it and who is affected? Second, we define risk and protective factors. What increases or decreases the chance of someone being hurt or dying? Third, we figure out programs that work to change those patterns, to avert injury, hospitalization, or death. And finally, we scale what works. America's total number of gun deaths is the highest on record, and our rate nears its peak. Firearm deaths have surpassed breast cancer deaths in America. Firearms are now the leading cause of death for American children age 1 through 19. Although mass shootings get the most media attention, 2/3 of firearm deaths are preventable suicides, averaged over the last decade, like that young man I cared for 15 years ago. I have story after story of public health collaborations between gun owners and non-gun owners, hospital workers and community violence interrupters, faith leaders and survivors. We have shown we can reduce the risk of a shooting long before someone picks up a gun with intent to harm. Through your bipartisan commitment to this public health approach, our country can reduce firearm injury and death for all.
Let me ask you this. In September of this year, our New Mexico governor issued a public health emergency order, and she suspended the right to bear arms in Albuquerque and the surrounding county. Do you support that?
I do not. What I do support is the work that New Mexico has done with...
Do you support that?
No.
You don't? Okay. Let's see. During his first 2 years as the DA in Philadelphia, District Attorney Krasner Krasner and Loster dropped 47% of all the illegal firearms cases in the city. Do you agree with that?
I'm not a lawyer. I'm a physician and a public health professional. I can say that New Mexico has done amazing work in trying to address the suicide and partner violence.
I'm asking about Philadelphia.
I don't have an
The
opinion.
DA dropped 47% of all the illegal firearms cases. Did he do the right thing there?
I don't have an opinion. However, I will say that just as with fentanyl, the spread of illicit
I'm
substances.
sorry to cut you off, but I'm
That's
running
okay.
out of time.
Understood.
The LA District Attorney, George Gascon, said that he would not prosecute any sentencing enhancements for guns or gang-related activity. Do you think he did the right thing?
Again, I am neither a lawyer nor a prosecutor.
You don't have an opinion on that?
I honestly don't know enough about it to have an opinion.
You don't think gangs should be prosecuted for having illegal guns?
I'm neither a lawyer nor a prosecutor, and that's not my area of research.
But yet you want to take guns away?
I've never said that I want to take guns
from
away.
law-abiding citizens.
I think that you are saying something that I've not said in my written or oral testimony, sir.
Okay. You equated gun deaths to heart disease in your opening statement.
Yes, sir.
Which is a greater public health problem, gun deaths or heart disease?
So heart disease does kill more folks across the United States, largely in the
That's
end of their life.
700,000? Mm-hmm. Yeah. Gun deaths about 50,000?
Correct.
Do you support outlawing fried foods?
I'm sorry. How does that relate to?
Because fried foods contribute to heart disease, don't they?
Again, I have not written or said that I support outlawing.
You're a physician, right?
I am. Have I said that I support outlawing anything in my testimony today?
Okay, let's talk about what actually happened in that room, because the clip everyone is sharing online does not tell the full story. Senator John Kennedy is one of the most skilled rhetorical performers in the United States Senate. He has a law degree from Oxford. He's a former state attorney general. The aw shucks Louisiana drawl, that's a performance, a very effective one. And his strategy in that hearing wasn't to debate firearm policy, it was to extract sound bites. He wanted Dr. Ranney to say one of three things: that she supports confiscating guns, that she defends progressive prosecutors, or that she's out of her depth. She refused to give him any of the three, so what you witnessed wasn't a senator destroying a witness. You witnessed a witness refusing to be destroyed. Here's the detail almost everyone missed. When Dr. Ranney mentioned that greening vacant lots and repairing abandoned buildings reduces gun violence, Kennedy laughed it off as word salad. But that is not opinion. That is a real peer-reviewed body of research, primarily from the University of Pennsylvania, showing measurable double-digit drops in gun assaults in neighborhoods where blighted lots were restored. Kennedy didn't engage with the science. He mocked it. And then there's the deeper moment. The son of the first responder, a child who took his own life with his parents' gun. Dr. Ranney brought that story into the United States Senate. Not one senator on either side followed up on it. They moved on to sound bites, to fried foods. That silence tells you everything about how this country actually treats firearm suicide, which is 2/3 of all gun deaths in America. Watch Dr. Ranney's body language. She never raises her voice. She never rolls her eyes. When Kennedy says word salad, she absorbs the hit and goes straight into her credentials. 20 years in the ER, a top-tier trauma center, dean of Yale School of Public Health. That's not defensive, that's surgical. She knew exactly what Kennedy was doing, and rather than match his energy, she refused to participate. The fried foods question, she didn't laugh, didn't argue, she just calmly asked, "Have I said that I support outlawing anything in my testimony?" That single sentence is the entire hearing distilled. He was answering questions she never asked. She refused to be his straw man. So why does this exchange matter beyond a viral clip? Because firearms are now, and this is not a talking point, this is CDC data, the #1 cause of death for American children between ages 1 and 19. Not car accidents, not cancer, guns. And the United States Senate, the body responsible for federal firearm policy, just spent its time asking an ER doctor whether she wants to ban fried fried chicken. That is not a debate. That is a deflection strategy. Every time public health professionals try to discuss firearm injury the way we discuss tobacco or seatbelts or drunk driving, or they get the same treatment Dr. Rani got. Mockery, misquoting, pivots to crime statistics that have nothing to do with the witness. Until that pattern breaks, the death rate doesn't break either. So here's the question I want you to actually sit with. If a board-certified emergency physician who has spent 20 years pulling bullets out of human beings isn't qualified to talk about gun deaths in front of the Senate, then who is? Drop your answer in the comments. I read them, and if this is the kind of analysis you want, the part that goes beyond the clip into what actually happened, subscribe, because we do this every single week. I'll be honest with you, I don't think Senator Kennedy lost this hearing because of Dr. Rani. I think he lost it because the camera kept rolling after his one-liner, and the data didn't blink. See you in the next one.